To be honest, I've heard of all type of cancers, but I never heard of multiple myeloma.
Multiple myeloma. It's painful, uncommon, and hard to diagnose. We meet one determined survivor and ask why this cancer happens more often in Black Americans. Good morning. It is Friday, March 21st. I'm Jessica Lovell. Welcome to the Morning Medical Update. Today, we meet a patient who made it through some very dark days on his cancer journey, and we'll reunite him with one of the doctors who helped guide him through his long, difficult treatment. But first, let's get to today's morning rounds. The drug that can reverse an opioid overdose will soon be available over the counter. Naloxone, sold under the name Narcan, is a fast-acting nasal spray, and this week the FDA approved it to be sold without a prescription. The company that makes it says it should be on the shelves by the end of this summer. Dr. Rupa Sethi joins us now. Dr. Sethi is an addiction psychiatrist here at the health system. Good morning. How are you?
Doing well, thank you.
Good to see you. Thank you for sharing your information regarding this. You help people with addiction problems on a daily basis. Help us understand really right now how bad this opioid crisis is here in our country.
So right now we are in an opioid epidemic. More than 100,000 people died of overdose in general in 2021 in the United States. And about 70,000 or more of these deaths were synthetic opioids or opioids related, and most of this opioid was fentanyl. In Kansas itself, we had more than 600 overdose deaths, which kind of talks about how big of a crisis we are in right now.
Yeah, Dr. Sethi, I feel like I've heard you call it the opioid epidemic for so long. We look forward to calling it something else at some point, but Narcan is already used, as we know, by police and paramedics. So how helpful will it be to make this available to the public?
It will be very helpful to get Narcan available to the public. Think of it like an antidote to an overdose. If somebody has an allergy, we have them have an EpiPen. So yes, the police and the paramedics might have it, but then the patient also has it. So if you have an antidote to an overdose, which is naloxone that I have in my hand right now, it is good for everybody who needs it to have it with them.
So who should carry it? Somebody who's struggling with addiction issues, family members, friends? Tell us about that.
So it's a very good question. Actually, anybody who's prescribed an opioid, even from a doctor, should carry it. Anybody who's prescribed opioids along with benzodiazepines, and when I say benzodiazepines, it's something like alprazolam, clonazepam, Klonopin, all those medications, because they have a chance of causing overdose as well, should carry it. And of course, somebody who's developed an addiction or developed an opioid use disorder and is in a treatment or wants to be in a treatment should also carry this medication.
So, Doc, some people dislike the whole idea of Narcan because they think it might encourage drug use. What is your reaction to that kind of thinking?
Addiction is a disease at the end of the day. If we treat diabetes, if we treat allergies with an EpiPen, why not have an antidote to a medication which can prevent overdose and can save a life?
Dr. Sethi, thank you so much for being with us this morning. We always appreciate your insight.
Thank you.
Multiple myeloma is a kind of blood cancer affecting the white blood cells in your bone marrow. Symptoms like fatigue and pain can start slowly. Alexis Del Cid introduces us to a survivor whose symptoms progressed into the worst pain he has ever felt.
I feel great. I feel really great.
There was a time David Rolfe couldn't conceive of feeling great ever again.
It's been a long journey, just staying focused, praying a lot.
It began in 2016 with excruciating back pain that felt like it was radiating from his spine.
And they was real sharp, like spasms. And I had no clue what it was. And when they hit, I would fall always to the floor. I couldn't stand up and I would just cry because I couldn't tolerate the pain.
His primary care doc had him go in for an MRI, which didn't reveal anything. From there, he was prescribed pain medication, sent to a physical therapist, and then a chiropractor. None of it helped. In fact, the pain got even worse, and he suffered another 5 months.
And one day I was coming out of the bathroom, and I thought I was having either a heart attack or a stroke.
The next morning came the stunning diagnosis: cancer. But not just any cancer, multiple myeloma, cancer of the plasma cells in the bone marrow.
It shocked me, and I was still in denial because I pretty much was a healthy person. You know, I never was a drinker, never been on drugs, and never was a smoker.
He was about to embark on a grueling journey that would test his body, his relationships, and his faith.
'Cause I knew this was a battle that it was out of my hands.
And we are happy this morning to have David Rolfe with us. Good morning to you. Here in studio with me is Dr. Layla Shune. She's an oncologist, a bone marrow transplant physician, and a specialist treating people with multiple myeloma. Good morning to you.
Good morning.
Good to see you. Be sure to ask your cancer and multiple myeloma questions. You can use the chat on YouTube, Facebook, or you can tweet us or email us at the Medical News Network. That info is right there on your screen. David, let's start with you. We heard in that story that you were in pain for months before you ever got a diagnosis. The pain got worse and worse. What was that like, having a pain and then not knowing what the cause was?
It was very excruciating. You know, it was a pain that I could not tolerate, you know, and I had no clue what it was. And even after I was being put on medicine by my primary doctor at the beginning, he had no clue what it was either. And I mean, it was just pain that I can't even really, to be honest, describe.
Painful and frustrating, I would imagine. You started treatment in 2015, and we know that can be difficult. What did you go through with your treatment?
I started off with radiation, and I think I was getting radiation for about like about 4 to 5 months, and I was still going through that pain because it was so bad. Whereas they had to help me get on the table and position me because I just couldn't tolerate it. Period. And they would send me home with medication, but at that time too, I was in that wheelchair because it actually took me 14 months to learn how to walk again, you know, and it was just a day in and day out where I couldn't take it, you know, and then when they was able to find the right medicine to prescribe, I mean, it helped a little bit, but it was unbearable, you know, because I was on a walker, and every time I took steps with a walker, it would take me about a good minute just to land my feet because I would just cry. I couldn't tolerate it, period. And even going back and forth to my doctor's appointments, I couldn't even tolerate the bumps in the car. You know, it was like from my head to my feet, I would just cry. It was a pain that I wouldn't wish on nobody.
So David, how are you feeling today compared to back then at your worst?
I feel, oh my goodness, you know, God is good. You know, I feel like 100%. You know, it's like I do everything normal like I used to, you know, and I know it still exists in my body, but, you know, I have moved on. I pray, and I thank Him for what, I thank God for grace, you know, and what mercy truly means, you know, and He's blessed me to endure in this, you know, gave me the strength to endure in it. And I want to be an encouragement to a lot of others out there that don't have the voice to speak up or fight, you know, to hang in there and don't give in to it, and support those and be a reason that I can help others in so many different ways, and be a reason to help someone else smile, because you just don't know what they're going through, you know. And being able to just share my story and be a shoulder for anybody, you know, and a voice for anybody.
Well, we hear your voice. You sound great. We appreciate your words. You look great. I want to bring in Dr. Shune, because technically speaking, there's no cure, doctor, for multiple myeloma. So how do you describe David's situation?
That's a good question. So let's go back and understand, what is multiple myeloma? Multiple myeloma is a rare blood cancer. It's a disease that affects the bone marrow. our bone marrow is like a factory. We have multiple cells working together to sustain our blood system. Within the bone marrow, there's a cell called plasma cell. And the plasma cell is part of our immune system. And one plasma cell can go rogue and start multiplying in large numbers and crowding out all the other good cells in the bone marrow. This plasma cell can attach to the bones and cause the bones to be hollowed out and cause fractures, like what David has been dealing with the back pain. And the plasma cells, because they're multiplying in large numbers, they can cause anemia, low blood counts, they can cause nerve damage, they can secrete proteins that can cause kidney problems. Now, in the past, we felt that myeloma is not curable, but that is not our goal in the future. Our future is to cure myeloma. And to achieve this aim, we are using cutting-edge technology, advanced therapy, combining it with transplant. So the notion that myeloma is not curable, that is something we want to leave in the past. Our goal is to give David and people affected by myeloma a long, healthy lifespan.
Quality of life.
Correct.
I want to talk about something else, because earlier we mentioned the racial disparity in this particular cancer. According to the National Cancer Institute, African Americans are at twice the risk of developing multiple myeloma when compared to white Americans, as well as dying from multiple myeloma. So Dr. Shanae, do we know why this is?
That's a very good question. So African Americans may have a genetic predisposition to multiple myeloma, but other factors also play a role in why they will die of multiple myeloma. So for every, there's a 2-to-1 chance of 2 people with multiple myeloma, there's a twice the chance of dying of multiple myeloma if you're African American compared to a white American patient. And the reasons are genetics, but more importantly, the things that we can control are access to great health care. If you treat, there was a study that was published in 2019, if you treat patients with multiple myeloma, African Americans, white Americans, all together the same way, you'd have the same outcomes. They will all do well. So if you do the correct treatment, you'll have the same outcome.
So let's talk more about that access, because there are all kinds of research, clinical trials that we know about where patients can get cutting-edge treatment. So Dr. Shanae, what's it going to take to connect more Black folks with novel treatments like this? How do we get them there?
Education. Education and advocacy. That's why I thank David for coming on the show today, to spread the word that if you have the right therapy, you'll have a great outcome. And it's our role as physicians and healthcare providers and healthcare workers to go into our communities and educate people that myeloma is not a life sentence. You will not die of this illness necessarily if you are able to access the right therapy. And also, my role is to educate primary care physicians, because at the front line of care is primary care physician. For example, David, when he had severe back pain, he went to his primary care doctor. His primary care doctor was not knowledgeable about myeloma, but I can teach that doctor how to test in the blood, just a simple blood test, and he will have discovered the myeloma right away. So our job is to educate our patients, our physicians in the community, and all health partners to be aware that myeloma affects African Americans at a higher proportion, and we can diagnose early and use cutting-edge therapy to reduce the risk of dying.
So healthcare empowerment, ask
Absolutely.
Questions and keep searching.
Yes.
There is one important study from 2019 in the journal Blood. It focused on patients at the Veterans Administration. So in the VA system, it's easier to make sure every patient has equal access. And this study found that African Americans actually had a better survival rate compared to white patients. So Dr. Shanae, just what do you make of that study?
It's quite simple. It's quite simple. When you receive novel therapy, the right therapy, cutting-edge therapy, you'll have a great outcome. So this is preventable. We can fix this problem, and that's great, because then we can make it so that everybody in America who's diagnosed with multiple myeloma gets the right therapy and gets a good outcome. It's actually very encouraging.
It goes back to the access and the education, as you mentioned. So recently on this program, we highlighted one multiple myeloma treatment called teclistamab. It stopped the pain for one patient that we featured here. Do you find cutting-edge therapies like that promising? What is it telling us?
Absolutely, absolutely. 5 years ago, we had one kind of therapy. 5 years later, we have multiple therapies. Teclistamab is an immunotherapy. We have CAR T, whereby we collect immune cells from the patient and engineer those cells to fight myeloma. So we use the patient's own immune system to overcome myeloma. So these new therapies have less side effects, they are targeted to the myeloma, and they can deliver very good results.
So David, as you shared, we know you now went through so much pain. How has this changed you as a person?
For a long time, to be honest with you, I lost David, and I didn't know how I was going to get back to being me, and it was just a journey that I wouldn't wish on anybody, and I had no clue of to come out as well. But I'm just grateful and thankful now that I got through it, and with the support of the doctors, and I appreciate Dr. Shanae, and I love her as my doctor and a patient, and that was very important, with the doctors, because they always been supportive and they done everything in detail, and that meant a lot to me. And having family support and prayers, and the main key is just thanking God that I'm still here, and I look back on everything, and it's just something that you just don't take life for granted. I had no clue, because I've been a healthy person all my life until this took place, and it's changed me in a lot of ways, to be a better person, to be uplifting to others, be concerned about others, be giving to others, and I just want to be a voice that anyone else is out there going through it in any shape or form or way, to lend a hand and help them in any shape or form or way,
Just you sharing your story today is helping so many people. Dr. Shanae mentioned it, just having him represent people and share his journey, and you give hope to people. You give hope to people, and we appreciate you sharing your story with us. Hang tight. I want to get a quick COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us on this Friday morning. How are you?
I'm good.
Good.
It's nice
Good morning.
and warm. Yeah.
Yeah, right?
Yeah, right now, unfortunately, the COVID count has gone really the wrong direction. We started out in the low 20s this week. Right now, 46 total, but 30 active, 5 in the ICU and 1 on the ventilator as well.
Well, there's some reassuring data on the Pfizer bivalent booster for COVID-19. I want to ask you about this. A French study published in the New England Journal of Medicine looked at hundreds of thousands of people. It found zero evidence of an increased risk for stroke, heart attacks, or pulmonary embolism. So, Hawk, if you add this to the pile of evidence that the vaccines are safe, just what else is this telling us?
Yeah, we alluded to this a little bit yesterday, and I think this is a really good correspondence and article, again, published in the New England Journal of Medicine just this week. What the researchers did is they had already looked at groups who had gotten monovalent vaccines, so that first booster and those first dosings, and they did not necessarily see an increased risk of stroke and cardiovascular events, whether that's in the brain or the heart. And now what they did was actually compared the monovalent booster group to a group of bivalent booster people as well, and saw absolutely no increase in chance or risk of cardiovascular events, meaning stroke, heart attack, anything else like that. So just as you said, it continues to add to the evidence, just as Dr. Stites has talked about the safety of these vaccines. And we also have a good amount of data now, clinical data, supporting their use for the reduction in the risk of hospitalization and severe disease as well.
Do we have any reporters with us today? Let's get to some community questions. We've got a few coming in. First one is from Lynn. David, this question is for you. Lynn wants to know if you go to any follow-up visits.
Yes, I do.
What are they looking for?
Just my basic treatments, a lot of blood work, looking at the multiple myeloma, and also my kidneys, because it did some damage to my kidneys, but my kidneys are steady, where it's not to the point where I have to be on any dialysis. And so that's what they pretty much look at, is my kidneys and my multiple myeloma.
Dr. Shunay, is that pretty typical for
Yes.
patients like David?
Yes, patients like David who are diagnosed with multiple myeloma, we keep a close eye on them. We do PET scan, which is a whole body scan. We do bone marrow biopsy to really investigate and make sure that we are able to catch the myeloma early. If it's time to come back, we catch it early and intervene on that.
So will he be a forever patient, always getting checkups?
Absolutely, absolutely. My goal is to make sure that David has a long life. And for that, I have to be meticulous about his care, yes.
So Peyton wants to know, Dr. Shunay, what symptoms should I watch out for? How do you know if it's multiple myeloma?
Peyton, that's a very good question. So when you go to see your doctor and you're feeling fatigued, ask your doctor, do I have anemia? And if so, could this be myeloma? If you have severe back pain and you go to see a doctor, ask your doctor, doctor, could this be myeloma? Can you do X-ray of my back, and can you check my blood? If you have nerve damage, numbness and tingling in your hands and legs, doctor, could this be myeloma? Could you please check my blood? So fatigue, weakness, back pain, broken bones. If your bone is broken because of a very minor trauma, that could be myeloma. Prolonged back pain like David's, that could be myeloma. You know, it's a disease that's hiding, but it can easily be discovered if only we think about it. So ask your doctor, Doc, I'm an African American. I come from a community of African Americans. I have severe back pain. I know myeloma is more common in African Americans. Could you please check my blood? Because we can discover multiple myeloma with a simple blood test.
Well, I'm glad you answered that, but I've got to ask Jeremy's question anyway, because he was also wondering if he could proactively be screened for this regularly. Is it something you have to be showing certain symptoms or signs, or is it something that if maybe you have a family history, or you just want to know what's going on inside your body? Is there what other questions could you ask to get that blood test?
So if myeloma has no symptoms, we don't treat it because it takes years to become myeloma. So we don't want to scare the population with fear of something that may never even happen, right?
Because it's so rare.
Because it's so rare. But if you have symptoms, that's when you really, really need to look at that.
And those symptoms are tricky.
They're very common.
Yeah.
And they could easily be taken for granted. Oh, you're just fatigued, sleep more, right?
Whose back doesn't hurt, or
Everybody's
tired?
back
Everybody's
hurts,
back
right?
hurts, right?
Yeah. But if this back pain is not getting better, worsening, excruciating, it's worth looking at.
Really pay attention.
Yes.
Martha was asking, again, kind of similar. David had described that horrific pain that he was experiencing. So why does multiple myeloma cause that pain to be so severe?
So the myeloma cells, they will leave the bone marrow and attach to the bones, and they hollow out the bones, and they cause the bones to break. So what you're dealing with is actually a broken bone in your spine, in your hips, in your legs. So this excruciating pain is caused by myeloma eating the bone like a moth, hollowing it out, and causing microfractures. That's what's going on.
So Susan's asking, is it hereditary? So if mom, dad, grandma, grandpa had it, is that something that children up and coming should be aware of?
That's a good question. So there's no direct inheritance from parents to a child, but myeloma can cluster in families. So you may have an aunt or an uncle, and then they can skip a generation. Maybe somebody in that family could have myeloma. So if you have any family history of myeloma, you are predisposed to the myeloma, not 100%, but there could be a slightly increased risk of getting that myeloma. So if you have a family history and you're having back pain or weakness, it's worth telling your doctor about that and having that checked in your blood, yes.
So Eric wants to know, why is there no cure for this particular type of cancer? We see cures or no evidence of disease in other particular cancers, but why this one?
That's a very good question. So we can eradicate the myeloma in the body, but it will try to come back because the myeloma cells can hide and evolve. What we're doing in today's world is we're using all the good therapies early. You know, in the past we were using therapies sparingly because we didn't have much, but in 2023 we have all kinds of therapy. We're combining them, using them in all together. So we have achieved actually a 20% cure rate. Our goal is to get to 100% cure rate. And that's something we are very ambitious about, we're going to strive for, and hopefully deliver that.
Well, let's get today's takeaway from our program. Great discussion, great questions from our audience. David, I want to start with you. What do you want those listening and watching to take away from today's conversation?
If this occurred with them, just follow up, with your doctors in general. Your health is more important. Any little symptoms, any little signs that you get, it's just so important, because I had no clue that it was multiple myeloma, period, and just follow up, and your health is more important, just seeing your doctors on a regular basis like you should, because when this took place with me, I had no clue that this was going to happen, but it did. But, I'm still here, so I'm grateful for that.
Yes, you are still here. You found access to these treatments, you educated yourself, and you got to the right people like Dr. Shunay. So thank you so much, David,
Yes.
for being with us this morning. Dr. Shunay, final takeaway today. What should we know?
What we should know is that in 2023, there's great hope for myeloma. We have great therapies. If you're diagnosed with myeloma, please don't despair. It's highly treatable. You can have a great life. We have great therapies. Try to get in with a myeloma specialist. Request a referral to a myeloma specialist who can use cutting-edge therapy on your behalf. That's number one. Number two, as David said, take good care of your health. So if you have symptoms that are not getting better, ask your doctor, could this be myeloma? Could you please test my blood? And that could get you on a path of real healing and real help.
And when you talk about those therapies, explain to people what you mean by that, because I think that that hope that you talk about, when you talk about the therapies that we have right now and where they may be heading, what are you specifically talking about therapy-wise?
So we have used stem cell transplant to very good effect. It can prolong your life. It can get you off all this, really resolve your symptoms. But when I talk about cutting edge, I'm talking about cell therapy, whereby we collect immune cells from the patient, engineer those cells in a laboratory, give those cells back to the patient, and they're extremely powerful against myeloma. So we're trying to use your own immune system to destroy myeloma. So that is available, FDA approved. It's very exciting.
The CAR T therapy you were mentioning earlier.
Yes, exciting, powerful, effective, great hope.
Thank you so much for being with us. Dr. Hawkinson, today's takeaway from you.
Yeah, I want to thank our guests. Thank you, Dr. Shunay. It's always good working with your teams. And I would just kind of piggyback on what they said. Know your health, understand what your symptoms are. If they continue and persist, keep looking for those answers. If you tried treatment for any specific symptoms that's not working, then look for other answers. Maybe seek out other advice from other medical practitioners. And on the takeaway from our headline today, certainly Dr. Shunay and her teams really promote and endorse the benefits and safety of these vaccines. They are giving these vaccines, specifically these COVID vaccines, but also many, many other vaccines, to this most immunosuppressed, this sickest group of people, because they believe in the safety and efficacy of them. So if you are not up to date with any of your vaccines, please make that effort. Again, taking your own health into your hands, getting up to date with those vaccines.
Doc Hawk, thanks so much. Thanks to all of our guests, and as always to our viewers for being with us today. Have a great weekend, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update, a 23-year-old woman becomes the 100th proton patient at the University of Kansas Cancer Center. I'm Jessica Lovell on the next Morning Medical Update. Stylee Gray's tumor is complex, but not too complicated for our proton therapy specialist. Her story Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.